below that, and then you're going to give compressions.
Hi, this is Abir, and today we will get advice in
Welcome. Today we're going to talk about something most people and patients come to the clinic and ask me about. It's the fatty liver. Liver with fat. We call these patients, sometimes they have no symptoms. They come to do an ultrasound for something else. And we found that the liver has been surrounded by fat. This is not good if you have a fatty liver. It's a sign where you need to start to look into it in more details. Why we do that? Because fat in the liver can cause liver failure, fibrosis. The liver starts to be rigid and cannot do what's supposed to be done. And patients may have a lot of symptoms. When you reach the stage where maybe you need a liver transplant. So to prevent that, we always say patients with fatty liver, 20% of these patients, that means from every 5 patients with a fatty liver, 1 of them will develop liver cirrhosis or fibrosis and they will require liver transplant. So we want to prevent this. These are the main measurements you should take when you start to do, when your doctor tells you that you have a fatty liver. We see fatty liver not only on people obese or with a heavy weight, we also see it with the thin people. So it doesn't matter if you're thin or overweight. You will have fatty liver if you don't take care of your liver. We see it more common with patients with diabetes, especially type 2 diabetes. So if you have a diabetes or if you have a raised liver enzymes, if you do a blood test in your clinic as a routine, even if you don't have any symptoms, your doctor will advise you to do an ultrasound to find if you have a fatty liver. Now, what to do if you have a fatty liver? One important thing you should know, there is no medication to treat a fatty liver. We don't have a tablet to treat. We don't have an injection to treat. The main thing to treat a fatty liver is your diet and your exercise. These are the 2 main factors to treat a fatty liver. And we see it more with elderly. The more you go on with the age, the more you may have a fatty liver. So those people who have fatty liver, we sit down with them, we classify them, which type of fatty liver they have, or what stage they have, maybe stage 1, stage 2, 3 or 4. Your doctor will sit down and try to do some investigation to make sure that you don't have any kind of damage to the liver. They will ask you to do some investigations. They are very important to classify which stage you are in. Then after that, they will start to sit down with you to put a plan to do the best to reduce these fatty liver. One real fact, if you lose 10% of your weight, most of these fats will go away. So if you catch the fatty liver early and you start to do modification of your lifestyle, your fatty liver will go away. So these are our targets. This is the reason why we go on the media to tell people. We want you to be educated about this, and we want to make sure that everybody who is watching this to understand that there is a treatment for fatty liver, but it depends on you. And it's very important to catch it early. Now, what to do if you have a fatty liver? First, we sit down and look into your diet. And we try to reduce the fat you take, reduce the carbohydrates you take, and increase the proteins and vegetables and fruits. These are the main things you will do in the diet. And the more details, it depends on individual patients. That will be between you and your doctor. The other thing is to ask you to do some exercise. The more you walk, the more you do exercise, jogging, swimming, whatever kind of exercise you like, this will make the circulation better. That will reduce the fat around the liver. The liver will start to work better, and then the patient, with the time, will lose that fat surrounding the liver. It's not a short-term goal, it's a long-term goal. And that's why you need to be patient, and you need to focus, and you need to work hard to make sure that you satisfy these requirements to reduce your fat in the liver. Now, some people may try to use tablets or medications. We don't have an evidence about that, so we don't advise you to take anything. And I strongly advise you not to take anything outside your doctors without discussing this with your doctor. So you always should focus to get the information from the right person and from the good sources. Now, it is important to understand this fatty liver require a follow-up with your doctor, require you to stay on the pace above all these. Don't take the risk, enjoy your day, and there is always a solution you will find within your clinic. All the best.
Today we will explain how a shareholders agreement is executed or implemented according to Kuwaiti's company law. A shareholders agreement is an agreement that describes rights and obligations of the shareholders who own shares in a company. The shareholders agreement should be in compliance with the company's law and articles of association of the company. If shareholders, they are unable to include all their rights and obligations in the articles of the company, so the shareholders can have a separate arrangement among themselves for the implementation of the provisions of the articles or the obligations of the company. The requirement is the shareholders agreement should be in compliance with the law and the articles of association of the company. Generally, shareholders enter into some rights and obligations outside the articles of the company and these terms and conditions are agreed to run the company in a smooth manner by protecting the rights and obligations of the shareholders. These issues are regarding management of the company and decision making of the company, capital requirements, and to control the expenses of the company, and delegation of authority. A company is an artificial person, but it is run by individuals, and those individuals manage the company, and the management includes decision making. The decision making process requires involvement of the managers who are the directors of the company, and once a company decides, the company's management decides to do something that is first in line with the objectives of the company, and then the management of the company, they decide in the interest of the company all those actions or inactions which must be in line with the company's law and the articles of association of the company. Therefore, this obligation should be used by the shareholders, which they exercise to control the company in a smooth manner and to run in accordance with its articles and law. The law says parties can enter into a shareholders agreement either before establishing a company or after establishing a company. But the requirement is the shareholders agreement must be in compliance with the law and articles of the company. Any contradiction between the shareholders agreement and the articles of association or with the law will prevail, or if it is in contradiction with the articles of association, then the articles of association will prevail. Therefore, in order to enter into a shareholders agreement, the shareholders are required to know the articles, the contents of the articles of association and the legal provisions of the law, so that whatever they agree, that must be in compliance with the law and the articles of the association of the company.
Yes, again, hi Kuwait, love you all, Kuwait TV. We'll speak again today about long time our staying at the office, okay? Since we stay long time hours and we forget ourselves beside computer, typing or using a phone, we also need to give some exercises, because every day you go back home, what do you feel? You feel lower back pain, you will feel neck, you will feel your shoulders, okay? You feel sometimes your leg, because when you feel your back, you will feel pain in your legs sometimes, okay? And it can be advanced. So you need to go doctor and check it, of course, but same time we can make stretches and exercises can help you and benefit too much, okay? I choose to do this kind of exercise and segment and speak about stretchings, element 1, element 2, between starting and finishing, which much important actually. And we miss it too much of people exercising gyms. And I want to say it again, and important, they forgot stretch. Stretch and start. Stretch and start, stretch start, between, end. By warm up and cool down, of course, and your exercises. So, you are at office, we did some exercises for neck, stretches. Now what we need to do? We need to do our back also. We do not forget our back. Okay, we come front, we lower seat down, put our seat down, we put shoulders here, and push down. Okay, and head down. And look at me what I'm doing. I'm doing my front shoulder, that, and same time I'm putting my body down, okay? And here, now I lower back, and I'm looking straight. I look up to you, and I move from here. 1, 2, 3, 4, 5, with my neck. Okay, I'm doing like that, you know, turtle? Look at me, and do 1, 2, 3, 4, 5, 6. If you count, just count 25 at least, or 15 at least. If you can do 2 to 3 sets, any exercise will be much better, okay? Of course, beginner can do 2 sets to 3 sets, intermediate, long time, feeling more pain, exercising, not only using computer exercising, too much stretch and pain, stress, you need to make at least 5 sets. So increase your sets, increase your reps. Most important, when you go more advanced, you need to increase it a little more, because when you are advanced, athletic trainer, and you are using computer a long time, you feel more pains sometimes, okay? And if you are not athletic, you are beginner, okay, just always office and long hours, also you will feel a pain, which you need also to increase the sets so you feel better. From here, we can put our hand and our shoulders back, okay, and twist right. Look at me, I'm using my chair and twisting left. Look what I'm doing here. I'm using my chair to support me and twist, okay, for lower back, okay, L's. For L's, and here, we'll go neck for C's. And what we do, more and more important, if you are sitting here, we go our body front, stretch, hands, and same time put in our back, same position, we put our back from here, and we pull it back, okay? The best exercise I like, I created in rehab training when I study, and I like it, it helped me too much because we're feeling in the upper shoulder, back pain, okay? Not only neck, not only shoulder or trapezius, sometimes your hump muscle or upper back. Put for front, hands, Look at me. Try to do it and follow it. Believe me, you feel much better in upper back. 1. See, I'm taking my shoulders up, back, down, up, hold, back, down, up, hold, back, down. See how many? 1, 2, 3, and from here 4. And I hold. I hold my back here. From here, I hold it back. Shoulders down. Okay? And go back down. 5. Okay? Set your hand straight again. Bring it inside. Hold it here. And same time. Same exercise. I like the most actually. And when I did the rehab training exercise, I started to do it. And from many days, I felt much better. I changed. It will take like 3 to 4 days to feel better and change. Not direct, not from first exercise and from first day, okay? So, take your time, do it each day if you want, if you're feeling still pain, upper back, and go on. See my hands, coming here straight. 2. Don't forget, deep inhale and exhale. 3 back, deep inhale. Hold, exhale. 5. We use it actually for martial art, also concentration, and at the same time we flex our shoulders up, and same time we remove the stress in upper shoulders, okay, or upper back. So again, we go inside, look at me, 1, 2, 3, 4 from here, 5 out. Come inside. Wait, love you.